What screening protocols or support systems tend to work best for at-risk families?
So that's a good question. What screening protocols exist for at risk families for mental health disorders, for obesity?
Both. Let me clarify. Yeah, for either, let's say for mental health and for, let's just go with mental health.
Okay.
Yeah,
So the protocols we have in place.
yeah.
Okay.
So, what screening protocols or support systems work best for at-risk families that are dealing with mental health disorders, like what we mentioned with the mothers?
So the screening protocols we have in place, at least with the American Academy of Pediatrics, who is the authority that kind of sets all the protocol and policies for pediatricians, is we have a depression screening. And so the recommendation is to screen every parent that brings a child in before the age of 9 months for depression and then act on it if depression is present. So that right there kind of gives you a clue. And then anytime that you suspect, I've had moms come in and I'm just like, you said you weren't depressed, but I've been talking to you for about 10 minutes and I feel like you're a little sad. Can we talk a little bit more about that? So that's the number one. Number two, other protocols we have in place to identify um, what is it, mental health issues
Hmm.
or
Hmm.
moms.
The
Oh,
support systems.
support system. So that was for our tiny babies. So um, for our older kids, when they come in for visits, we have what's called a ACE, Adverse Childhood Events Screener Questionnaire, where we ask parents about different things that have gone on, food insecurity, has anybody touched you in the wrong way, those type of things to kind of identify other uh, adverse events that we can help with.
How does a child's genetics impact how susceptible they are to the adverse effects of maternal obesity before they're even born?
So that's a really good question. Let's say, for instance, a mother has twins and she suffers chronic obesity, right? The twins are fraternal, meaning they don't have the same exact genetics. But one twin is what we would say is a normal twin, doesn't have any genetic issues going on. And maybe the other twin has a condition that means they're just going to be small, like they're just tiny. And so mom has maternal obesity and maybe she has preeclampsia. Maybe she has high blood pressure. What that means is her placenta that's carrying the child may not get enough blood flow through it. And the biggest effect of that is the child doesn't get enough blood flow or nutrients as they're growing. So if you have the typical developing twin that's maybe not getting as much blood flow, when they come out, maybe they're just a tiny bit smaller, right? But then you get the twin that is genetically predisposed to be smaller, not get enough blood supply. When they come out, they may be in the NICU. Their brain may not be developing as well. They may have a hard time gaining weight. And we know that newborns that have a hard time gaining weight end up becoming the ones that have a hard time getting the weight off.